Good afternoon, it's Kelly. It's Sunday afternoon. I just thought I'd do you a quick video. This week I've been fiddling around with lots of skin tags, and I thought that I would just do a little video to try and reassure people that I know that you get some skin tags in some really unusual places, because I have been removing some skin tags from some really unusual places in my career and also this week. So I just wanted to say it's nothing to be embarrassed about. I have been a nurse and a midwife for a very long time. There is no part of someone's body that I have not seen or probably put my finger in at some point in my career. Anyway, so I know skin tags can be troublesome because they get caught on your bra, or sometimes they're in the groin area, they get caught on people's boxer shorts, and obviously they bleed and things. So it's a really very simple procedure. I did put some before and after pictures up this week so that people could see that it's an instant removal. It's not entirely pain-free. There is a couple of kind of twinges and things like that, but it's a really effective treatment. It's quite inexpensive, and of course it's permanent. So yeah, take a look at the before and afters. And guys, if you have skin tags that you want to have removed, just book in and have them done, because it will make your life so much more bearable. Okay, hope you have a happy Sunday, and I will speak to you soon. Bye for now. Okay, so just a quick follow on from my video about skin tag removals. I thought I would show you on an apple, because I don't have any live guinea pigs with me this morning, but I thought it would just be interesting for you to see how the Plasmage actually works and how far deep it penetrates into the skin without actually causing you any major problems or discomfort. So what I'm going to do is I'm just going to get my foot pedal right, because it's fiddling around down here, and I'm just going to do a few little kind of treatment points like I would do as if I was doing a procedure. And then what I'll do is I'll cut the apple open, and we'll actually see how deep it goes, so you can see that how it works. It's called sublimation of the tissues, and what that basically is doing is reducing the tissues underneath. So initially you swell more, but swelling is always a good sign that we've got a good treatment in. So I'm just going to do a few points and then we'll have a little look. Okay. So you can see as the nib hits the skin, or the skin of the apple, it creates a tiny little arc of lightning which creates a little burn. Obviously you're numbed for this when you're having the treatment, but what those little or series of little burns are essentially doing is reducing the tissue underneath and tightening the tissues, and that is how it reduces your eye bags or removes extra bits of skin that we don't want anymore. If this is how I would do a procedure like a blepharoplasma, as they were calling it. Now if we was doing something like a skin tag, so I don't know if you can see those little series, I'll try and hold it right up for you, little series of burns, that's how we would do a blepharoplasty. If we was doing something like removing a skin tag, we would change the setting on the machine and a slightly different way of holding the pen. So I'll just show you that now so you can see as well. Okay, I'm back. So I've changed the setting, sorry, on the machine, and now we're going to do as if, so can you see that little fleck on the apple? What we're going to do is we're going to pretend that that's a skin tag that we want to get rid of. So what we would do is we basically are colouring in the area where we want to treat, and if you can see now, it's gone. So it's as simple as that, really. Nothing to be scared of. You are given numbing cream. You're giving 3 cycles of 12 minutes each. I hardly felt a thing, 1 or 2 where I kind of thought, oh, that was a bit sore. Swelling, yes, you do get some swelling, a little bit of soreness for a couple of days after it. Obviously with eyes, they're quite a sensitive area, so they can swell quite significantly the day after, but as I say, it's always, for me, it's a sign that it's going to be a good treatment. Anyway, so what I'm going to do now is I'm going to cut the apple and have a little look at how deep within the apple it's gone, so you can see. People have fears that it's going to burn their eyeballs out and all sorts of things. It's not going to do that to you, but just so that you can see this, so it'll reassure you. I'll be back in a second. Hi, it's Kelly. I'm back reporting to you now in the evening of Sunday. I'm afraid that I didn't get to finish off my apple experiment, I've got to be honest, because my little girl woke up, and when my little girl is awake, nothing gets done anywhere, as I'm sure all your mums out there can sympathise with me. Children monopolise your time like you wouldn't believe. Anyway, so I did cut the apple open, I did give it a little inspect, and what I can report is that I saw absolutely no damage at all. Now, as most of you know, the Plasmage machine is what we call fractionated, which means it is safe to deliver treatments such as the blepharoplasma, removal of, I can never say this word, alexanthemia, fibromas, verrucas, warts, skin tags, and various different extra bits of skin. So it's safer, it's more gentle, and I would say from having an inspection of the apple that certainly there was no signs of any very aggressive trauma that had been caused by the plasma machine. So I just wanted to finish off this video because I hate having things left unfinished. I'll edit the video now, and then I'm going off to have a Sunday evening and do some reading and have a little bit of Kelly time rather than mummy time. Anyway, I hope you're enjoying the videos. If there is anything that you'd like to ask me, as I say every time, please do. I'll direct you to the website, which is www.fillyourface.co.uk. There's lots of information on there. As you all know, you can always email me, WhatsApp me, anything you want to do, really. Way of contacting me is absolutely fine, and I will do my very best to answer the question. If I don't know the answer, I'll tell you that I don't know, but I will do my best to find out the correct answer for you. Okay, so that's me signing off for Sunday. I hope you've all had a lovely weekend, and I'll speak soon. Bye.